Hi guys, welcome back to my channel. If you're new here, my name's Amanda and I'm 31 and currently pregnant with my first baby, a little boy who's due in the beginning of May. And this week I'm going to be giving you my 26-week pregnancy update. So last week, if you had watched my video, I had a really scary call from my doctor after I took my glucose test to test for gestational diabetes. And so basically my levels were through the roof. I was at 191 and they were like, oh my gosh, we have to schedule you to come in right away and talk through all the things that you're gonna need to do to change what you're eating and how you're exercising and things like that. So last week I kind of had a really bad week, had a meltdown, cried a bunch of times because I was just shocked at this diagnosis, and I wasn't sure if I had done something wrong, if I had been being unhealthy or what. But after talking to my doctor and for all of you guys that shared your experiences and kind of reassured me that it was probably nothing that I did personally to cause this condition. It's something that happens within the placenta and it usually goes away after pregnancy. So basically, I went into my doctor on Monday for a follow-up appointment after I took that glucose test. And I saw the nurse. If you guys have been watching my videos, you'll know that my doctor is actually on maternity leave. And so I have been seeing the nurse for the past like 4 visits that I've gone there. So I saw the nurse on Monday and she basically told me everything that I already knew about gestational diabetes and how to get it under control. So the first thing that she said was that because my level was at 191 after the test, I didn't need the 3-hour test at all because there was no question as to whether or not I had gestational diabetes. They diagnose you at, I think, 200 if your level's at 200 or above. So, I mean, I was literally there, and that's why they didn't offer to give me the 3-hour test. She did say that I could take it if I wanted to, but from what I've read, the 3-hour test is really, really miserable. So I was just like, no, I'm fine with it. Let's just try to change things. So she said the first thing that I'm gonna do is have to cut out a bunch of carbs and a bunch of sugar. So she basically said no bread, no rice, no pasta, no potatoes, like all the white high carb foods. Take them completely out of your diet. And this is not a problem for me because I don't eat those things on a regular basis. Like occasionally if we go out, I'll eat pasta, but they are not staples in my diet, so that was no problem. She said to focus on lean protein and veggies, and she told me that I have to start tracking everything with a glucometer. So I have been, and it's right here. I'll show you guys in a second, but basically I have to prick my finger 4 times a day. The first time is when I first wake up after I fasted for, however many hours I was sleeping, and that reading, if everything is okay, should be below 95. Then I have to eat my 3 meals a day, breakfast, lunch, and dinner, and 2 hours after every meal, I have to prick my finger again, and for all of those, my levels should be 100 or under 120. So I'll just show you. I mean, this is like the little kit that they gave me, like this is the glucometer. In here are little, they're like little strips that you stick in the bottom of this, and this pen right here is where you prick yourself. So I use the pen, prick myself, take the blood, put it on one of these little strips in here, and then stick it in here, and it'll give me my reading. It's honestly, it's not a huge deal. I've been doing this for the past, let's see, so I've also been writing down literally everything that I eat and all of my levels too, just so that I can figure out what works for me and what doesn't. So this week is pretty much a testing period for me. I'm trying to just figure out whether what I've been eating is severely making my levels go up, my blood sugar levels, or if what I'm eating, I can kind of stick to it with certain modifications. So I'm just kind of using this week to experiment. And literally all of my readings have been within the ranges. So for example, on Tuesday, which was the first day that I actually went through the whole thing, when I woke up, my fasting blood sugar level was 77, so below 95. After I had breakfast, I did it and my level was 83, has to be below 120. And then after lunch, I did it again. My level was at 100, so it crept up. And I had also eaten one of these almond butter coconut Greek yogurts that I think they have a decent amount of carbs and sugar in it. And I also had a small cookie. So I'm kind of just testing the waters. So 100, that's still within the range that's okay. And then after dinner, my reading was 102. So that entire day, I was totally fine. Today, which is Wednesday, I logged again, and when I woke up, my levels were a little bit higher than the day before. It was at 89, so still under 95, but no problem there. So for breakfast, I ate what I normally eat, just an egg on a piece of Ezekiel toast, and I had cooked 2 slices of turkey with cheese to go on top of that, and I also had a few saltines with peanut butter on them. And then I did a workout, and then I tested my levels again, and I was at 74. So exercise it's obvious that exercise really helps to level out your blood sugar levels, and 74 is the lowest number that I've had, even lower than my fasting number. So just keeping that in mind for myself, if I plan to have something that's sugary or more carb dense, I'm going to make sure that I work out on that day. So then after lunch, my level was 82. So again, that's pretty low. It's well below 120, and I'm pretty happy with it. I honestly haven't drastically changed anything about my diet. The only thing that I've done differently is cutting out the sugar and the sweets that I usually have for dessert. So, I mean, if you watch my previous pregnancy vlogs, I was eating, the gummy savers, candies, and Skittles and chocolate and stuff like that. So, and I probably was eating way more than I should. So I'm having a lot less of that. I ate 10 gummy bears last night, and I also had 10 chocolate covered almonds. So I'm still getting my sweet fix without having to completely cut things out. That's basically the update for the gestational diabetes. I mean, I definitely have it, as my doctor said. They're considering this a high-risk pregnancy now that I have this, and starting at 33 weeks, I'm going to be going in for an ultrasound every single week up until the day that I deliver, just to make sure that everything is okay. So I'm really hoping that just continuing to eat the way that I have been, exercising regularly, and just being mindful of what I'm consuming, I'll be able to just keep monitoring throughout the pregnancy and not have to take any medication or get insulin shots or anything like that. So I go back next Thursday, and the nurse is going to review all of my numbers that I share with her, and then let me know what the next step is. But for any of you that might have gestational diabetes or failed your glucose test, literally, I'm here to tell you that you didn't do anything wrong. It is not your fault. Some people are affected by it and some people aren't. I mean, I'm assuming that genetics has to do with it, but, don't beat yourself up thinking that you were being unhealthy or you were harming your baby in any way, because it is something that can be managed. And honestly, I'm looking at it as a blessing in disguise so that I can just have a really, really healthy third trimester and hopefully maybe have less symptoms or negative symptoms that some people have, like in the third trimester. Who knows? I could be totally off and be miserable or whatever, but yeah. So that's the update there. Aside from that, I feel like I'm a complete mess. Like oh my gosh, 26 weeks pregnant. Another thing that I had recently discovered is I'm pretty sure that I have a hemorrhoid. So first time for that, but I read that it's pretty common in pregnancy and it's really nothing that's bothering me at all. So whatever, I'm just leaving it. I'm not like gonna get any medication or do anything about it, but it's just something that I'm dealing with. Freaking hot mess over here. So I've got gestational diabetes, I have hemorrhoids, like what else could there possibly be? So not aside from those things, that's pretty much what's gone on in week 26. I am having a lot harder of a time sleeping throughout the night, and I think it's mainly because I feel like I have to pee all the time and I'm constantly just getting up and going to the bathroom, so I can never like fully fall asleep and remain asleep for a long period of time. So I've been waking up really tired. I also feel my energy levels just kind of waning a little bit. I'm a lot less energetic than I was a couple weeks ago. So when I go into the office to work, at the end of my workday, I am so completely exhausted and just ready to hit the couch. Like yesterday, I got home from work and I literally passed out on the couch and took a 3-hour nap. So I'm kind of starting to feel my body changing a bit and moving into my third trimester. It's definitely getting a lot more real. The baby is moving around so much. I think he actually sometimes gets the hiccups because I'll feel like a consistent like bump, 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 you know, like beating in there, and so I'm assuming that that's hiccups. But it's funny, when I'm sleeping, he seems to be awake, which is annoying. So depending on how I'm laying, he doesn't like it sometimes, and he'll start kicking and like punching and like moving around a lot until I move to another position. So I think it's so funny. I can't wait to get my next ultrasound because I feel like he's grown so much. So in terms of weight gain, 26 weeks, I was 136 pounds. So that's a 19-pound gain from the start of my pregnancy. I'm 5'1", so I started at 117 pounds prior to being pregnant. So 19 total. I definitely look pregnant now, and let's see, I think the baby is, how big is he this week? At 26 weeks, the baby is as big as Kale, and he's 14 inches, which is so crazy to think about. Like 14 inches seems really big, I guess, when they're stretched out, but like they're probably curled up in a little ball or something in there. And then he's 1.5 to 2.5 pounds now. So it says that in my app that he's taking breaths of amniotic fluid and rapidly developing senses, features, and talents, and he's got eyelashes now, and also he can sense light. So if you put like a flashlight or, you know, like the light on your phone over your belly, they should be able to respond and start moving around because they can sense the light, which I think is so cool. I don't have any stretch marks yet, which is great. I'm so excited. I heard that they can come on like later down the line, like in your last few weeks, so I might get them. My sister didn't get stretch marks and my mom didn't get stretch marks either. So, and I actually haven't been doing much of anything to prevent stretch marks. I'll put like the cocoa butter lotion on my belly after I shower, but I don't have any specific routine to like prevent stretch marks. I heard that it's genetic, you'll get it or you won't get it, but so whatever. I'm kind of just embracing everything that's coming along with pregnancy. So before I show you guys my belly shot, I just wanted to let you know that next weekend, President's Day weekend, me and my husband are flying back to New Jersey for my baby shower. So I'm really excited. It's a Southern gentleman theme, and it's like a tea party, and it's at this like historic colonial type house that they turned into an event space where you can host your events and things like that. So I'm super, super excited. Can't wait to see all of my friends and family, and I'm gonna try to vlog some of that and upload it after we get back. Let's do the belly shot at 26 weeks. Here it is from the side. Here it is from the front. And from the other side. The tag there. Here it is with just a shirt on. Alright guys, so that's pretty much it for 26 weeks. So I'll definitely give you an update next week on the gestational diabetes and how all my experiments are working. I definitely want to try to eat Chick-fil-A because that's just like, it's been such a staple. Like I would go to Chick-fil-A every Friday. So I'm curious to see what my levels are, like if I worked out and then ate Chick-fil-A, if my numbers are like through the roof or not. So I'll keep you posted, and if any of you guys are experiencing it or have been diagnosed, please let me know how you're doing and how you've coped with it and any tips or tricks that... Okay, Siri for some reason just thought that I summoned her. Freaking weird and creepy. But yeah, let me know if you have any tips or tricks that have worked for you to keep your levels at a normal, like consistent level. Thank you guys so much for watching and continuing on this pregnancy journey with me. If you haven't already, please subscribe, and I'll talk to you guys in the next one. Bye.